starting the timer, and here is your question. Right, so if you have read and understood, considering it history taking station, kindly begin.
Yes.
Hello, hi, good morning. I'm Dr. Moon, one of the doctors here.
Yes.
Hi, can I confirm your name and age, please?
My name is Braun, age 64 years.
Ron. Okay, Ron. So I've been asked to take a history from you. So may I know what brings you here today?
Doctor, I have pain my abdomen, and I have caused decreased bowel habits. I am not going to toilet for 2 days, and I have also passing blood in my stool, and this is the problem. And I do not want to eat something. My clothes are also losing down.
Oh, I'm really sorry to hear that, Ron. So would you be able to tell me a bit more about the blood in your stool?
Yes, sure.
Like when it started and what color is it?
Yes, for the 2 days, it several times when I go to toilet, there is a blood, and it is color is not it is brownish type of red, and it is amount. Sometimes it is 1 teaspoonful, from sometimes few drops, and sometimes half cup.
Yeah. So
I'm very disturbed. What is the problem with me?
oh, I really understand that it might be worrying a lot as there is blood in your stool. Anyway, you have come to the clinic, so we're always here to support and assist you throughout this to reach the diagnosis and help you with the treatment plan. Are you happy with that?
Yes, sure.
Okay. So is the blood mixed with stool, or is that on the toilet pan or on the paper?
Sometimes it is drop wise, and sometimes small amount of stool. I am not satisfied for passing stool, and it is mixed with stool. So it is brownish in color. Sometimes it is red in color.
Okay. Is there
different
any
pattern?
Yeah, all right. It's fine. And is there any mucus?
No,
With your
no
stool?
mucus.
No
No,
mucus.
no mucus.
Right. You mentioned there has been change in your bowel habit. Is that right?
Yes, what are you saying?
You mentioned there has been change in your bowel habit.
Yes, yes, madam. It is change of bowel change of habit. And previously I go twice a day or once a day, and now I am not going daily. And a small amount of a stool come. I am not feeling satisfied by passing stool.
Are you able to pass daily? Are you able to open your bowel daily?
Yes, yes, previously.
And is there any? So how many days has it been there? Have you been constipated?
Yes, yes. I have low frequency of going to toilet for the last 2 days. Previously, I was also observed that I am not going daily to this.
I'm sorry to hear that. Yeah, and that do you open winds? Can you pass winds?
Yes, yes.
Okay, yeah. Recently, have you been feeling like even though you have been to the loo, you feel like you have the urge to go to the loo again for the for number 2?
Yes, I'm not satisfied. I am not satisfied. I am trying to go to toilet repeatedly, but nothing is happening. Only small amount of blood will come,
Right.
and I am
Okay.
discomfort in my abdomen, not
Mhm.
pain but discomfort due to
Alright.
not passing a stool.
That kind of discomfort, does it relieve with passing stool?
Yes, this is passing with veins and stool.
Have you been noticing any change in your appetite?
Yes, I do not like food nowadays.
How's your weight? Is there any change in weight intentionally?
Yes, my clothes are loose, and it is 10 pounds. It is, I think I check that it is loose.
Okay,
Lost 10 pounds in
yeah.
recent weeks.
Sorry to hear that. And is there any other area? Sorry, is there any other? Have you noticed anywhere bleeding as well?
No, madam.
All right. Are you on any medication such as blood thinners?
No, I'm taking blood pressure medicine.
Do you have fever these days?
No.
Have you traveled abroad recently?
No.
Okay. And then do you have any skin changes?
No skin changes.
Any painful swollen eyes?
No swollen eyes.
Okay, and there is no tummy pain. Okay. So do you is there any diseases you see in GP regularly?
Just for blood pressure, I visited regularly.
Yeah. Okay. Are you on any medications for that?
Yes, he gave me some calcium channel. I don't know what is the name exactly.
Right. Is that under control?
Yes, it is under control.
That's great. Have you undergone any surgeries before?
No, madam.
Is there a family history of cancer?
Yes, my father have some colon cancer, madam.
Can you
And he died.
summarize your history now, please?
So I just took the history from this patient who presented with blood in bleeding paratum, which is brownish in color. It has been for 6 months on and off which is brownish in color, but no mucus, no bleeding for other areas, and he has a strong family history of cancer, and he has systemic features such as loss of weight, loss of appetite, and so my provisional diagnosis and discomfort is relieved by passing stool.
Okay.
My
So
provisional
what are
diagnosis
your
is colorectal carcinoma.
Okay.
I will also consider inflammatory
Yes.
diverticulitis, inflammatory bowel disease, maybe blood disorders.
Okay. How would you confirm your diagnosis?
By doing abdominal examination, including digital rectal examination, colonoscopy. For the imaging, I will do colonoscopy or sigmoidoscopy at outpatient clinic. And then for the blood, full blood counts to see if there is any drop in hemoglobin, along with group and saving to plan for transfusion in case if necessary. And then CRP and WBC counts to see if there's any infection. Use and ease for dehydration, acute kidney injury for bleeding, dehydration, and then CEA for colorectal carcinoma.
Okay.
So these
you
are the
mean tumor
investigations.
markers? Okay.
Yeah, tumor markers.
Considering your first provisional diagnosis, what is the most important investigation that you will carry out?
Is colonoscopy.
Very good. Okay. What about the rigid sigmoidoscopy? Can it be done?
Yeah, it can be done.
Okay, good. Right. Yeah. Okay, very good. But since you didn't get to complete your history, if time would have allowed you, how would you have completed your history?
Yeah, if time allowed, I would process with drug allergy history, and then occupation, alcohol, smoking history,
social
and then
history,
ICE, social history. Yeah.
Yes. Okay. Are you satisfied with the presenting complaint, the history of presenting complaint that you took? Was it satisfactory in your opinion?
I still missed the features of anemia.
And the amount of blood which patient was sent, because patient did say sometimes there was red, sometimes it was brown. Then you have to ask how much, what was like the amount. So it was a streaks, or were they a teaspoon or tablespoon, or a glass full of blood. So you have to ask the amount, and then how it started, the course, duration, severity, if there are any aggravating or relieving factors, any other associated factors. But you did ask for the weight loss, unintentional weight loss, and the appetite. So that you covered. Yeah, you did also covered about the gas. So the verticulitis. Okay, you did even ask for the constipation, so that was covered. Yeah, most of the things you covered, but it was just, and even the travel history you asked. Yeah, just this little bit you could have asked. So good, thank you.
Thank you very much.
Thank you.